These are the principles we will be following, built on the policies that you have debated and passed over the last several years. We accept the premise that healthcare costs should grow roughly in concert with the state's overall economy. We continue to maintain that the process to achieving that goal must be crafted very carefully. Don't throw everything out. Fee-for-service still has a role to play. Beware of unintended consequences. In the end, the final legislation must support our ability to provide the health care that we are able to provide, and anything else is unacceptable. We must preserve patients' access to care. We have worked too hard to reach 98% coverage, and we cannot retreat now. We must sustain the independent physician practice. While hospitals may be the backbone of the healthcare system, the practices are the flesh and blood and just as essential. We must protect the vital healthcare jobs that drive our state's economy. We must foster innovation, without which we will never improve. We must simplify administration of healthcare, not complicate it. We must stand firm in our support for disclosure, apology, and offer. And finally, we must expect the unexpected. No economic model can predict everything that human beings will do or need. The legislation must give us the flexibility to make adjustments as we go. This is a learning process, and there's a lot at stake. Of course, this seems also very difficult, and I wouldn't blame you if you wondered, is it worth this effort, and how are we going to do this? Well, less than a week ago, I had the privilege of being the commencement speaker for the Massachusetts College of Pharmacy and Health Sciences. It was held in this very building downstairs in the hall. More than 700 people received their degrees: pharmacy, nursing, physician assistant, imaging technicians, nutritionists, pre-meds. It went on endlessly. You could really feel their excitement as they stood on the brink of their career in healthcare, and it was very inspiring. They represent what's happening in healthcare today, examples of the great promise that we see in healthcare reform. When I started in medicine, and many of you have heard me say this, and many of you are in the same boat, it was assumed that most of us would be in a small, and perhaps even a solo practice, and we had to learn how to do everything ourselves because there wasn't going to be anybody out there to help us when we were in our offices. But not so today. Today, healthcare is a team sport. No single person can know everything. Everyone has a role to play, and every job is as important. Those graduates last week embodied the possibility, the promise of dedicated people working together, a team more for our patients than we could ever be before. This moment is our opportunity to build and lead that system the right way. Far from being a burden, this is a gift, the chance to create a healthcare system as we want it to be. Our work here this weekend is a piece of that puzzle. Like anything important, it won't be easy, but it is so worthwhile.